Hello, I'm Mark Davis with PAR. Welcome to the February 2nd edition of PAR Tuesday News Review, your timely source of news that is important to the IDA providers and our community. Governor Wolf was releasing his budget address on Wednesday instead of today due to the snowstorm. We will be watching his message closely for impacts on IDA and will communicate to members shortly after the governor's address. PAR is concerned about the future of our system with the pandemic hitting providers hard, adversely impacting both revenue and expense. We will continue to advocate for both short-term COVID-19 relief and a long-term strategy for the solvency of supports for Pennsylvanians with intellectual disability or autism. PAR is concerned with the availability and access to the coronavirus vaccine and the hesitancy of some DSPs and people with IDA to accept the vaccine, especially in communities of color. PAR is working with the federal CDC, Pennsylvania Department of Health, the Governor's Office, and ODP to protect people with IDA and DSPs from the coronavirus by improving access to the vaccine and reducing vaccine hesitancy. CDC is preparing to announce a new vaccine partnership to offer vaccinations in more community locations. Look for that to be coming soon. PAR plans to submit testimony to the House and Senate hearings on the vaccine this week. A PAR survey found that 21 Pennsylvania hospitals have denied care to 51 people with IDA, prohibiting DSPs from providing critical services to people with IDA receiving hospital services. In guidance to hospitals, the Pennsylvania Department of Health states, specifically, a hospital through its visitor policy cannot deny access to an attendant, caregiver, or family member of a patient who has an intellectual, developmental, or cognitive disability, communication barrier, or behavioral concern. Please note that the care given by the DSP in the hospital does not supplant nor interfere with nursing or medical care, but instead helps to support the person to understand and be willing to allow the hospital to provide the necessary medical care. PAR plans to continue to work with our partners to eliminate this denial of care. PAR is also preparing a template letter for DSPs to provide to a hospital in the case where they are denied entry. Thanks for tuning into PAR TRN. Stay safe, everyone, and we'll see you next week. Thank you.